Pregnancy. Pregnancy is a period of time in woman's life where she starts to get a bond with her child. Yeah, even in prenatal life, it's necessary to do care the child for attaining a healthy delivery with a healthy baby. So, here comes my few points or tips regarding the journey of pregnancy to be followed. So, first one would be regarding weight gain. If a pregnant woman does not gain enough weight, her baby also won't gain enough weight. So, the newborn will be at risk for health problems. Thus, every pregnant woman should gain an optimal weight during the pregnancy period to help for having a healthy sized baby. So, first, if a pregnant woman is of normal BMI before starting their gestational age of period, then that particular pregnancy woman should have optimal weight gain range from 11.5 to 16 kg. Next, if a pregnant woman is of overweight, that means coming under obese type before their gestational age of period, then they should gain only up to 11.5 kg. So 5.5 to 11.5 kg will be their optimal weight gain. So if a pregnant woman comes under underweight, that means their BMI is very low before their gestational age, then their optimal weight gain will be from 12.5 to 18 kg. So as they should gain extra weight than the other pregnancy women to compensate and to have a healthy sized baby delivery. Next is food habits. So during first trimester, that means first, second and third month of pregnancy, the pregnant woman should have a light-weighted breakfast and a large amount of food for evening meals because their symptom will be a morning sickness, vomiting and nauseation during morning, so they can't have a more food during a breakfast, so there should be a light-weighted breakfast, and to compensate it the evening meal should be of larger amount with more nutritions. Then during last trimester, that means 7th, 8th and 9th month, their symptom will vary, like heartburn will be there. So due to heartburn, their breakfast should be of larger amount to compensate their symptom. So evening meal should be with light weighted during last trimester. Next is for each day meal, to have a well balanced pregnancy diet, they should have all of these for their every meal, which includes protein, vitamin C, calcium, fruits and vegetables, whole grains, iron rich foods, adequate fat, and folic acid. Protein. Protein is a builder nutrient and it helps to build most important organs for the body, such as brain and heart. So, during neonatal period, the brain and heart gets developed only by having an adequate supply of proteins to the neonates. So the food contents which have protein sources as their larger amount is meat, poultry, fish, shrimp, cheese, milk, all varieties of nuts, beans. In beans, rajma and soya beans have more protein content, paneer, broccoli, spinach and avocado. Next is calcium. So calcium helps to develop baby's bones and teeth. So if mother have failed to consume the needed amount of calcium during the neonatal period, then no proper providing of needed amount of calcium from the food occurs for the neonates. So the neonates will get calcium from mother's storages, that is from a bone, and it will get given to the baby. So as a result, mother will become hypercalcemia and the hypercalcemic complications will be seen after pregnancy period in their later life. Food source for calcium in veggies like cabbage, wasabi, broccoli, radish and cauliflower, there will be a more amount of calcium content, and in beans, rajma, that is a red kidney shaped beans, then soya beans, mung beans, chickpeas, lentils and spinach. Then in fruits, orange. Then in dry fruits, almonds is a more important for calcium content. Then comes dates and figs. Then all varieties of berries. Then milk, cheese, sesame seeds. Next is iron-rich foods. So the extra amount of iron is needed by the pregnant woman for transferring oxygen to the baby through blood, because we know that in blood hemoglobin is present, and in hemoglobin the iron part of hemoglobin is the main source for transferring oxygen to the every cells of our body. So the same mechanism occurs to transfer oxygen for the baby. So through blood the oxygen gets transferred, the two from iron. So the iron is needed in extra level. So to increase the iron absorption along with iron in each meal, there should be adequate amount of vitamin C is needed. So 27 mg is needed per day. 27 mg of iron should be taken by every pregnant woman for each day. So the food sources having iron in more quantity is figs, lentils, grains, beans, and mainly bananas. We used to have bananas every day and easily it will be availed, right? So bananas have more level of iron. Then fig and spinach also have more amount of iron. Next comes folic acid. Vitamin B9 is called folic acid. So this folic acid helps in formation of healthy red bloods for neonates and in development of central nervous system. So if there is no adequate amount of folic acid supplied to the neonates, then the baby will born with defects in central nervous system, because there will be a neural tube defect from which the future brain and spinal column will get developed. So, to compensate the adequate need of folic acid during pregnancy, one should start having at least 400 microgram, that is 0.40 mg of folic acid per day for 1 month before being pregnant. So, what's the level for during pregnancy means they should have 600 microgram, that is 0.64 mg of folic acid per day during pregnancy. So if pregnant woman is not able to have these amount of folic acid per day, then due to lack of folates, they should be provided with folic acid supplements. Next, vitamins. Vitamin A content is more in carrots, pumpkins, sweet potatoes, liver of beef, spinach, broccoli, tomato, and cantaloupes. Cantaloupes means parangika in Tamil. Then vitamin C. Vitamin C is rich in tomatoes, potatoes, citrus fruits, broccoli, strawberries, cantaloupes. So these fruits and vegetables should be added in each day meal of pregnant woman. Next we can see regarding month wise. So during first 3 months, that is during first trimester, the most needed nutrients will be vitamin A, folates and ginger, because ginger will help in preventing a pregnant woman from vomiting and nauseation field. Then folates. Folates, as I said earlier, it's main source for development of central nervous system and also helps in red blood cells formation. Then vitamin A. Vitamin A will stimulate immune system and helps to fight off infections. Next, second trimester. In second trimester, calcium and magnesium is of needed, because calcium is mainly a good source for development of bone and teeth, and during second trimester only the formation of bone and teeth of babies occurs, and also calcium will help in reducing the risk of high blood pressure. Next, magnesium. Magnesium is essential in bone formation and also it helps to convert food into energy and also to regulate body temperature. Next, in third trimester, that is from 7th to 9th month, the most needed nutritions will be vitamin C, thiamine and water fibers. So, water and fiber, that is insoluble fiber, is needed in more quantity because main symptom in third trimester is constipation. So, to compensate the constipation, the pregnant woman is needed with more water and more insoluble fibers in their food. Then vitamin C, as vitamin C protects the cells against damage, the cells development is more likely to occur in third trimester, so vitamin C is needed for them. Then vitamin C keeps the immune system in a good level. Then vitamin C helps in functioning of the placenta. Next comes thiamine. Thiamine helps to release energy from the food needed by the pregnant woman. Next is don'ts, that is to be avoided by pregnant women. First is undercooked or refrigerated meats should be avoided by pregnant women because this is the main source for spreading listeria, that is which causes listeriosis. Next comes caffeine consumption, which means coffee, tea. Nowadays many women have been become addicted to coffee and tea, but during pregnancy period they should lower their consumption or else should be totally avoided because coffee consumption will more likely to cause low birth weight babies. Next comes cod liver. Cod liver oil is to some extent is more likely to be appreciated for pregnancy women to have, but if it is given in higher amount, then due to its higher level of retinol, that is vitamin A, they will harm your baby if it is taken in larger amount. Next comes raw or runny eggs, that is undercooked eggs. We should not have eggs in undercooked or raw because it spreads bacteria to the pregnant woman. So, as the end of this video, I will suggest some of the foods to be taken by a pregnancy woman as a daily basis. First, they should not skip morning breakfast. Next, they should have orange juice in each meal because it is more rich in vitamin C. Next, carrot juice. Just take 5 carrot and blend it to form a thick paste and have it each day. Next, milk, rajma, green leafy vegetables, grains, liver of beef, fish, broccoli, cabbage, soya beans, and cheeses should be added in each day meal. Next, I will suggest brown rice instead of white rice for every pregnant woman. That's all about this video. I think this will be more helpful for every pregnant woman. Thank you and do subscribe my channel.